All right. Can everybody see that?
Yes.
Okay, great. The concept proposal to reissue the SPARK Award Training Program. SPARK is an acronym for Summer Program to Accelerate Regenerative Medicine Knowledge. So I'll just back up a little bit briefly to remind you that CIRM has made investments in 5 major pillars. We think of our research pipeline as that including the discovery, translation, and clinical programs, but we also have supported an educational pipeline that produces trainees of all levels to participate in the workforce to help bring regenerative medicine to patients in need. So in my presentation today, I'd just like to give you a little bit of background about the SPARK program before I go into the new concept itself. So CIRM has been funding opportunities to support training and workforce development in stem cell-based research through our various education programs, as I just alluded. CIRM is proposing to relaunch the SPARK Awards, otherwise known as the EDUC 3 Awards, which support summer internships for high school students. Historically, CIRM has supported these high school internships through 2 different RFAs. The original award RFA was the Creativity Award, which was issued in 2011, and a revised version of this program, renamed the SPARK Awards, was awarded in 2015. As was the case then and is the case now, federal funding opportunities for high school level research training, particularly in the regenerative medicine space, are limited and disparate. We will be proposing modifications to the SPARK concept to bring the program into better alignment with the Proposition 14 objectives and to better reflect present challenges and opportunities. And I will be detailing these in my presentation. So a little bit of background about our training pipeline. We've supported training programs for 3 different levels. We had the research training grants, which supported pre-doctoral and pre-MD students, as well as postdoctoral fellows and clinical fellows. We also support the Bridges program, which provide training for undergraduate level and master's students around the state. And finally, what we're talking about today, the SPARK Awards, which support research internships for high school students. Now, in January, I came and presented an overview of the outcomes of these programs over the years, and we noted that we would be bringing concepts to renew these programs to you. We did bring renewal concepts for both the research training and Bridges programs, which were expiring. The research training program had been dormant, and the Bridges programs, the current awards, were actually ending. And the board did approve those new concepts in February for both of those programs. And at that time, we mentioned we would also be bringing the new SPARK concept for consideration in the near future, and that near future is now. So the SPARK training program concept has the following objectives. The goal is really to inspire, introduce, and prepare California's high school students about the field of regenerative medicine as it relates to human disease. These awards provide summer training opportunities and broaden the participation in stem cell gene therapy and related research to high school students who represent the diversity of California's population and who might not otherwise have opportunities to take part in summer research internships due to socioeconomic constraints. The goal of these programs is also to foster a commitment among trainees to the goal of accelerating the delivery of stem cell-based and gene therapy treatments to patients with unmet needs. While each SPARK program might be a little bit different, they all have some features in common. In all cases, a qualified program director based at the awardee institution is responsible for managing and coordinating all activities supported by these programs, as well as the recruitment of diverse and qualified students. In addition to preparatory courses and workshops, a key feature of these are, of course, the summer internships, which are hands-on mentored research at host laboratories at the awardee's institution, which are nonprofit research universities or institutes, or at partnering institutions with a stem cell, gene therapy, or regenerative medicine focus. In addition to the internships, the students participate in formal community outreach and patient engagement activities. And at the culmination of each program, there is an annual SPARK poster day where the students from all the different SPARK programs are brought together to share their research with one another and their CIRM team and their families. So what is different about what we're proposing today? The new Spark concept that we're proposing essentially builds off the established Spark platform that has been successful since 2011, but we are proposing some updates and improvements. The first is that we propose to expand the allowable scope of the research projects beyond stem cell science to include gene therapy and related regenerative medicine research in accordance with Proposition 14. These are the same types of changes we proposed and our board approved for the for the Bridges and the Research Training Grant programs that we brought to you in February. We are also proposing to allow the institutions hosting Spark Awards to partner with another organization in order to increase the availability and the diversity and types of host laboratories in which the students may be able to intern. As with all of the continuing and new CIRM concepts, we are providing more formal requirements to maintain and strengthen a focus on diversity, equity, and inclusion. And consistent with the language of Proposition 14, applications will be prioritized that offer matching funds or verified in-kind support, and those that enhance the geographic distribution of training and socioeconomic diversity. And finally, we are proposing some changes to the overall award amount and some changes to the budget structure that I'll go over on my next slide. And we think these changes help are better in today's economy and will afford more flexibility for recruiting and appointing a diverse cohort that includes socioeconomically disadvantaged students. So to give you an idea of what I'm speaking about when I'm talking about budget updates and changes, I want to give you an idea of what we have been doing all along and what we're proposing to do now. So in this table, I'm just going to walk you through the costs that go into an individual Spark Award fall into the categories that are listed on the left. So some of the funding goes to support stipends for the trainees themselves. Some of the funding goes to support some stipends for the mentors or the person who is working day to day to help the students during their internship. There's a small amount of money for research-related funds to offset the cost of the host lab. And there's some funding that supports trainee for the travel to the annual conference. In addition to those trainee costs, there are also up to $2,500 per student for program administration and indirect costs. This means the total costs per trainee is $7,975. And each of these programs was budgeted to support up to 10 trainees per year. Now, as you can see from the second and third column, the budget really did not change at all between 2011 and 2015. The amounts of each of those categories stayed the same. In the orange column on the right is what we're proposing for the new concept. The biggest change you'll note is the increase in the level of stipend up to $4,500. This has been recalibrated to align with the state minimum wage for an 8-week internship. Now, you'll note that there is a 0 listed for mentor stipends and research-related funds. Rather than just taking that money out of the budget, that has been moved under the program administration cost, which has been also raised from $2,500 to $4,000. We believe that this will allow more flexibility. The program directors can still use some of that funding to support mentors where it's needed. But what we've learned from managing these programs over the past 10 years or so is that in many cases, the mentor stipends aren't actually necessary. And in some cases, we've been told the research-related funds are more difficult to administer than worth given the value. So we felt that, and the program directors indicated that a little bit more flexibility with what they can do for the administrative costs could be helpful for them. So that's basically the basis of the new funding levels. And the total cost per trainee under this new proposal is $10,175, which I think is just about a 20% increase over what it was previously. So just to summarize this new concept that we're proposing, we would be asking for an allocation to support 10 Spark Awards. Currently, there are 7 that are active, but they are all ending when the final cohort of students completes their internships this summer. So we would propose to support 10 new awards, which would be a total investment of $509,000 per award. This would support 500 trainees in all. And as I mentioned on the previous slide, the direct student costs would be $5,250. The overhead and program admin would be $49.25. which means a total cost per student per year would be $10,175, which is a 22% increase since the 2015 RFA, but actually it's a 22% increase since the 2011 RFA, because I showed you the costs weren't actually raised at all in 2015. So in sum, the requested action for this new concept would be an allocation of $5.1 million, which would support up to 10 new Spark Awards, each with 5-year duration, that would lead to 500 trainees at a cost of up to $509,000 per award. And I can stop there and take questions if anybody has any.
Thank you, Kelly. Are there questions or comments from members of the board?
Yep.
Anne-Marie?
Marie has.
Yes, so first of all, thank you very much for sharing this proposal with us and for the clarity of the budget allocation so that we don't have to work so much through that, and it's extremely clear. The only clarification is this is in fact a summer internship. Is that what is called a summer internship?
Mm-hmm. Yes.
That's right? Okay.
Yes.
And so what that says is that we continue to support the fact that summer internships should be paid so as to not discriminate between high schoolers who can afford not to work over the summer and learn versus those who would have to have an income during the summer while they're learning. Is that fair?
Yes. Yes.
I applaud this. This is very much a long effort to be equitable in general in life. So great.
Okay, great. Thank you. Any other questions?
So Kelly,
Steve Julesgard. Sorry, JT. Steve Julesgard has his hand raised.
Steve?
Yeah, so remind me when you evaluate these programs for what you hope they achieve, how do you do that?
Well, they submit progress reports and they tell us how the efforts went over the past year. And for every trainee that comes into the program, CIRM receives an appointment form that lets us know whose lab they've gone to and when they started. These appointment forms do request some basic information about demographics. And so it's not mandatory, it's self-reported. But I would say that I don't think our appointment forms, we aren't able to understand what the socioeconomic situation is of the different trainees. But the program has always been targeting recruiting a diverse cohort of students. And I think what I've seen from the progress report suggests that that is the case. I know that as was the case with the Bridges Awards and the Training Grant Awards, when applications come in to either be renewed for funding or new applications come in, they will be required to report more extensively on their own internal data about their efforts. And so that's an opportunity that we will have to also evaluate that.
Do you get any feedback from the participants?
Yes, we do get feedback from the participants. So this program has, we have testimonials, of course, from some of the program directors, and we have outcomes, and some of the students who are in the programs earlier, we have information on where they've gone to college. Now, we don't have a complete story because a lot of these students do these internships as sophomores or juniors, and some of them are only graduating and just starting from college. I did, back in January, I presented some of the outcomes we did know about from a survey of a subset of those who have started college. And I don't have that in front of me, but half of them were enrolled in UCs. And I believe that another significant subset of them were in colleges or universities outside of the state or in other colleges or universities in California. And the majority of them that we've tracked have chosen to go into STEM. So the story is incomplete at this point because we don't have all of the graduation data from all of these students. But sorry.
Just one last question.
Yeah.
Do you have a way of so these are 5-year grants, right? Do you have a way of monitoring the institutions to be sure they're doing what they are doing and the ability to stop funding them if they're not successfully running a program?
Yes, absolutely, we do. They submit annual progress reports to us, but they also submit the appointment forms when they are able to place students in a lab. So each program has, up to 10 slots per year. So we know exactly how many people are appointed. We know their names, we know their birth dates, we know what high school they went to. We do have all of that information internally at CIRM. And at some point, if the board wanted to hear more about what we have collected, that is something we could bring to you. But we do track all of that, and we do monitor their progress every year to make sure that they're keeping up with their own goals, the goals of the program. And we do have the ability to stop funding or put it on hold or speak to them. The students have always come together at the end of each year for poster day. So we're able to meet those students and interact with them. We're able to hear about their posters. We were unable to do that last summer because of the pandemic. In fact, these awards were scheduled to actually end last summer, but the students that were recruited last year all deferred to this year in order to have the opportunity to do, for at least a chance to do their internships in person.
Mr.
And we
Chair,
will,
Yes, Art.
I'm sorry, Steve Dunn.
I think so.
Great. What Kelly just mentioned is very anecdotal, because when I helped start this program, the Sparks program in 2011 with staff, it was very clear that there was a very enthusiastic response. And I know, JT, you've been to some of the graduation ceremonies, and I've been to almost all of them. And you really find out the enthusiastic support of the parents, of the teachers, and of the students themselves, who are just remarkable in terms of their achievements and in terms of their poster presentations. And there's just there's a self confidence, and there's a self propulsion to continue to excel in this whole arena because of the enthusiastic participation of these students, which we may not be able to monitor socioeconomic or diversity as carefully as would be preferable, but we do know that we're providing outreach to those high schools, and I can speak especially to those in Southern California, which have had an impact on socioeconomic student populations in those regions. One of them was the Francisco Bravo High School, med school in Los Angeles. Francisco Bravo happened to be a dear friend of mine, one of the first Reagan appointees, and a doctor who practiced in Boyle Heights in East LA, which was profoundly significant. Yet he always supported students and getting involved in that arena. So we may not have, although we have the raw data at CIRM, we may not have the profiles as detailed as we would like, but all the anecdotal stories that I've been able to collect over the years are certainly enthusiastic.
and I
Thank
would
you,
just,
Art.
I would also add that part of the Spark program is a social media component for the community outreach. So it is possible to find the blogs and some of the work that the students themselves have done over the past years and see in person what they've been doing and their experiences.
Yeah, Larry, before we get to you, I just want to follow Art very quickly here. It is, everybody here knows, I've said this sort of repeatedly, this is one of my absolute favorite programs that CIRM has. I, like Art, have been, I think, to every one of the graduation ceremonies that are held late summer, where everybody convenes, and as Kelly says, they do their posters and give explanations to the work they've been doing. And it's year in, year out, mind-blowing how competent these kids seem, having come out of just a several-week program, having gone in, just having had some exposure to stem cell biology in their biology classes at school. And they all come out sounding like PhDs. Repeatedly, you hear that the experience for these kids is transformative, and it really energizes them and galvanizes their desire to pursue this later on in their education. And it's just a terrific program that has been very successful, and as we expand it, I'm sure will be even more so. And at a time when there's increasing emphasis on getting kids interested to ultimately enter the workplace as the field matures, this is the perfect vehicle to get them started. So I can't speak highly enough of the program, and Kelly, the work you've done to make it work and to be a tremendous success every year. So I could not be more enthusiastic about this. Larry.
Yes, thank you, JT. So I appreciate the enthusiasm, and of course I do see the value of anecdotal enthusiasm, but I guess what I do hear missing from this conversation is outcomes. So has it been concluded that outcomes data are just too difficult to get in terms of whether they become successful STEM majors? I mean, in principle, we have 10 years of students to go back to where we could evaluate outcomes and get some idea of what parts of the program are good and what parts might need to be revised. I spent my lunch hour on an NAS call about exactly this sort of issue, and there is a huge amount of emphasis on being sure we get outcomes data so that we know what does work and what doesn't work. But I can understand this might be too hard in this case, but I'd love to know.
Did you want me to speak on that, or did Maria? I see your hand is raised. Did you want to?
Chairman Thomas, may I just make I have a question for the board just based on this discussion? Yes.
Oh, I'm sorry, I was on mute. Yes, please.
Okay. So Larry, Dr. Goldstein, so when last Kelly reported on this, what she reported on was that out of 482 students who completed internships since 2012, there was just a report, and it was an incomplete report. So we certainly should be very deliberate about following up on all of the graduates from this program. So that is a very important thing to do, and we will do that. Of the 76 alumni who did report, so there were only 76 alumni who reported, they all went to college. So, but that may be a selection bias. And then 50% of those who reported and went to college, 50% went to a UC, 18% went to another California school, including Stanford, Caltech, and CSUs. And 32% attended schools outside of California, and these included Yale, Columbia, Harvard, Hopkins, Duke, so other types of institutions. But we will, so I wanted to, number one, say that we will deliberately and proactively, as well as for future programs, follow up on the outcomes, but also a request from you and from members of the board, if you have suggestions on terms of outcomes, especially from your National Academy, from your recent talk, from your recent meeting of what you think should be followed, we would welcome that to bring in so we can incorporate that into our reporting as well. And then the second piece that I wanted to ask the board is based on the input today. It sounds like a couple of things should be emphasized when this is presented to the full board. One is, number one, to emphasize that truly the value of these paid internships is highlighted, because that's something that the general public and the general stakeholder population should be very, very much aware of, that this is the intent behind the structure and the funding. The second piece is to do a little bit more in terms of reporting on what kind of progress reports come to us and how we measure, how the programs are on track. And then the third piece is, share general outcomes, but maybe speak to, prospectively that there will be a commitment to following outcome measures. And so I wanted to ask whether those three components would be useful for the full board presentation.
Yes. Plus, you got a thumbs up from Larry. Christina?
Thanks, JT. Wanted to follow up with either Maria or Larry or whoever might be best suited to answer my question, and that is that what do you think success looks like for this type of a program? Has National Academy of Sciences come up with sort of an outcomes that one should measure that indicate a success of a program? Can one prescribe those as leading or lagging indicators of the success of the program, or is this just too difficult at this stage of quote unquote sort of a career path?
So if I could just briefly respond to that, there were a lot of different outcome measures that were discussed today. I think it's a moving target still in terms of formalization. There are a lot of successful undergraduate and graduate programs out there that one could look to for possible outcome measures in terms of the DEI space. But I think for high school students, my gut instinct is that, you want to be sure that they make it to a good college, that they, you'd like to know, do they do a STEM major? And then if you have data beyond that, graduate school, medical school, or employment in one of the STEM industries, perhaps. So I think, and I guess the other point I'd make is, I certainly appreciate that tracking down all these kids and finding out what they're doing and getting them to respond by mail to forums and all the rest. And they have 17 addresses by the time they're 19 years old. I got it. It may be that the program directors ought to be the ones who have primary responsibility, at least initially, for tracking their students, because they know them. They have personal relationships with those kids and possibly their families.
So in response to that response, does the Science Subcommittee recommend that we add a provision in the activities of program directors tracking outcomes that then get for prospectively, not just what's happening during the course of the internship, as one of the activities that we would require from the program directors?
That would be great.
Okay.
So I think that'd be an excellent idea.
Okay, great.
Thank you, Larry, for suggesting that. Okay, are there other questions or comments? And if not, we need a motion to approve, as Kelly has laid out the requested action. Do I hear such a motion?
Yeah, I can do the motion.
Thank you, Anne Marie. Is there a second?
Second.
I think
That was Judy.
Judy. Thanks, Judy.
You bet.
All right, been moved and seconded. Any further discussion by members of the board? Do we have any public comment on this motion? Hearing none, Maria, will you please call the roll?
Stewart. I think he was on, he may not be on again. Deborah Deese, Anne-Marie Dulege,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins, Steve Julesgaard,
Yes.
Shlomo Melmed,
Yes.
Art Torres,
Aye.
Jonathan Thomas,
Yes.
Christina Vori.
Yes.
Motion carries.
Thank you. And Kelly, thank you very much again for overseeing this terrific program.
Thank you too. And I have to give credit to the people who managed the program before me. So Monty Vessel and Stephen Lynn both managed, and Karen Ring as well. They are all no longer at CIRM, but they did the due diligence on this program. And hopefully it'll continue in the future and it'll be even more successful. So I'm going to stop sharing my screen now. And thank you, everyone.
Thank you, Kelly.
Thank you.
Okay, on to item 4, consideration of supplemental funding for the existing alpha stem cell clinics network. I understand, Jen, you are going to be presenting on this.
Yes, thank you, JT. Let me try to share my screen. Can you see this?
Yes.
Okay. Sorry, getting ahead of myself here. Okay. So thank you, JT, and members of the Science Subcommittee. I'll be presenting to you a proposal today for supplemental funding for the alpha stem cell clinics. So just a reminder, in January, the CIRM team presented an update on this program to the ICOC. And as you know, the Alpha Stem Cell Clinics is a network with a $40 million investment by CIRM in personnel training and patient-centered care. And these clinics successfully are accelerating cell and gene therapies, clinical trials across the state, with over 105 trials supported since 2015, 82 from industry sponsors, 23 are CIRM funded industry and academic sponsors. And this is an over $57 million in industry contracts. And the first three clinics were launched in 2015 at City of Hope, UCLA, UC Irvine, and UC San Diego. And the other two were launched in 2017 at UC Davis and UCSF. So currently, all of the 5 existing awards in the Alpha Stem Cell Clinics program have ended, or they are approaching their award end date later in 2021. And a new concept proposal for this network, along with any other items in the Prop 14, would be brought to the ICOC with the strategic plan rollout later this year in December. And so thus we plan that a targeted relaunch RFA for this program wouldn't be until mid-2022. Thus, there is a challenge, as the Alpha Clinics directors have reported, that bridge funding is needed to support critical personnel and continued operations during this period of their award end date and possible opportunity for new funding in 2022. So this slide gives you an overview of the 5 awards in our portfolio. As you can see, the first 2 awards have ended at City of Hope and UCLA at the end of 2020 and early 2021. And the final 3 awards are anticipated to end in July and November of this year. I would like to note that the 2 awards listed that launched in 2017 were launched with operational milestones. So you'll see here that they were contracted with an award end date of November 2021. However, since they were launched with operational milestones, the end date of the award is actually determined by when that final milestone is achieved. And these 2 awardees have told us in their most recent progress reports that they're anticipated to achieve that final milestone early in May of 2021. And thus you'll see in that final column, the potential gap in funding could be up to 12 months. So based on the financial reporting we've received from this portfolio, the average annual expenditures per award is $1,360,000, with an average annual direct cost per award of $1,060,000. And the average facilities rate amongst the 5 awardees is around 22%. So today we're bringing to you a proposal for a 1-year supplement from June of 2021 to May of 2022, when we anticipate a new RFA could be launched. And this supplement would support talent retention and program activities that are specified in the original RFA concept, which include coordination of clinical research and manufacturing teams, regulatory support of the clinical operations and management and senior clinical research coordinators, product processing, biospecimen collection and coordination, management of the patient and public inquiries, and fee-for-service contracting. This allocation would be for a maximum amount of $1.1 million in direct project costs, plus any associated facilities costs for each award. Awardees would be required to submit a justification for this funding, along with a detailed budget for the CIRM team's review. And awardees with project periods less than 12 months would be required to reduce their direct costs in proportion based on the average expenditure burn rate from their financial reporting of about $92,000 per month. Thus, this proposal is a total allocation of $6,710,000 for these 5 supplemental awards. So this is just a summary of the budget proposal. Again, the average annual expenditures are $1.36 million, with the average annual direct cost per award of $1.06 million, and facilities rates have averaged around 22%. We're proposing a total supplement per awardee of $1.1 million direct costs, which would be up to $1.34 million in total award costs, for 5 awardees with a proposed allocation of $6.71 million. So today we're asking that the Science Subcommittee consider this proposal to recommend this to the ICOC for an Alpha Clinic supplement of a total allocation of $6.71 million.
Thank you, Jen. Are there questions or comments from members of the board?
Thank you
Steve has a
for,
question.
Steve?
Yes, I actually have a series of questions. So I'm going to start with the first one, which is, what was the expectation of the alpha clinics when they received their original allotment of money? Was there an expectation they were going to receive more? That's sort of question one. Question two is, you know, the only reason we're able to even consider this is I think, for the large part, is because of Proposition 14. I don't know, we had some funds left over that might have gone to do this, but if we didn't, what were their backup plans in the event that there wasn't any additional funding available for CIRM? And sort of the third question is was there ever an expectation that these alpha clinics would become self-supporting through the work that they're doing, things that they're charging both the for-profit and nonprofit sectors in terms of clinical trial work? So if you could sort of address those issues, because, you know, I'm just really curious about what their backup plan was in all of this.
Maria,
can
did you
respond
want to
to the-
jump in? Yeah.
Yeah, so I can respond to that, Steve. So with the original RFA, the expectation was that this would be a one-time award, you know, at the time of that RFA, that the alpha clinics would have the institutional support to become sustainable as a unit to support the activities laid out by the RFA. And as you've mentioned, Prop 14 provides for expansion of the alpha clinics. So the idea behind asking for a supplement is if they go back down to the bare bones and continue to just support what they could based on their sustainability plan, that level of support would be probably sufficient for some aspects of what the alpha clinics network does, but perhaps may not be supportive of kind of a broader vision, especially with the future expansion. So the idea is to maintain a level of expertise and personnel beyond what they may be doing when they support things such as sponsored research, et cetera. Without, you know, we're not prepared yet to present the full alpha clinics expansion proposal, because that'll come in with a strategic plan later on in the year, or, you know, at least introduced with the strategic plan and then brought forward for a formal consideration. But the expectation is the role of the alpha clinics will be expanded beyond what the original intent of the alpha clinics network was when it was set up 5 to 7 years ago. We are not proposing that we already incorporate new activities into this budget because that whole concept needs to be evaluated by the board and really examined. But the idea of what's proposed here is to maintain a certain level of activities related to the scope that was outlined in the original RFA. I hope that answers the questions.
Can I just one follow-up, please? So Maria, along the way, you mentioned that the original plan was after 5 years, the institutions would basically take over the running of these alpha clinics. That was the original vision. Is that correct?
Yes, and of course, the idea was that the institution would be able to continue the support of clinical trials to an extent. With these clinics, we didn't have any specification in terms of, you know, the level of support, et cetera, but that there would be the ability to support the clinical trials that was supported by the alpha clinics as laid out in the original concept.
All right, well, this is just a comment. It would be nice from my point of view if we're going to provide additional funding to these alpha clinics, that we might have a cost sharing arrangement with the institution that's involved with them, so that, you know, back to the original concept, they have some skin in the game in terms of making sure that these clinics are, you know, being financially supported. That's a comment, just a reflection.
Okay, thank you, Steve. Those are all good points. It definitely was the idea to be self-sustaining at the outset, and it's a matter for the board to decide if you want to put additional funding in or not. I think we can safely assume each of these institutions will be back if we decide to expand the program with a subsequent RFA. And I think we can also fully anticipate there'll be other institutions applying at that point as well. So it's all matters for deliberation for the board. Shlomo.
I just was curious. We didn't hear anything about there's no peer review of this request. This hasn't undergone any peer review at all. So just can you tell us that if it hasn't, can you give us the rationale why you're bringing a $7 million expense to us without having undergone peer review?
Sure. So these are 5 awards that have gone through peer review. And
I understand that, but I'm talking about for this request.
So sure. And this request is it's not a new proposal. It's not new activities. It's providing just bridge funding for the activities proposed in their original application for the period of time. So it's not not any new concept or new activities or a new evaluation or a new application.
Okay.
Doesn't the statute require us to spend funds on peer-reviewed research? The proposition language. I mean, I just asking.
Sure, James. Can you provide your expertise?
Sure, I'd be happy to respond. Yes, Dr. Melamed, the language of the statute does require peer review of scientific proposals. As Jen explained, in this case, a determination was made that peer review was not required because we would be funding the same activities that were the subject of the prior peer review for an additional increment of time.
Thank you.
Steve?
Yeah, so I want to get to the same point that Dr. Melamed was getting to, but in a different way. Were these requests for money pressure tested? Did somebody go back and say, okay, can you outline line by line where you have all this money that you're requesting where it's needed? You know, other than, I hope it's just not somebody coming in and say, this is what I need for this, you know, to continue for the next X number of months. I hope you got a real itemized description of why they need this money. Was that the case?
Sure. So for this request for the actual amount, that was determined by their actual expenditures through their financial reporting and what they've spent on in their reporting periods. In terms of how we'll review their proposals, they will submit a proposal of activities and a budget justification. Again, these are for essential personnel and key operations, so it will be evaluated by program staff and grants management. And so it's an up to amount and doesn't mean that the total award amount will be allocated.
Okay, great, good.
JT, you're on mute.
I do that because I'm expecting my dog to bark on cue every time I'm about ready to say something. Any other comments, questions from members of the board? Maria?
I'm just seeking direction from the board based on Steve Joelsgaard's comment on cost sharing. Was wondering if the board wanted to discuss that further and give instructions back to us in terms of whether you would wish to have that, you know, included into a concept brought forward to the full board, if that's appropriate.
Thank you, Maria. Very good questions. So we don't have a motion yet. Steve, would you like to propose a motion that would incorporate that thought if you deem appropriate?
Yes, I'd be happy to. So the motion would, in essence, approve the requested action, but with the additional proviso that the actual money allocated be split 50-50 with the institution. In other words, the institution would provide as much support as CIRM is supporting for the amount of money they've requested, or they will be requesting.
Thank you. Sorry,
Is there a second?
yeah, I was just about to ask, are you seconding, Art?
No.
Is there a second to the motion?
Second.
Seconded by Anne Marie. Further discussion by members of the board?
Yes, JT, it's Art. I only have one concern, and that is these applications were not made.
Art, I'm sorry to interrupt, but you're in conflict on
Oh,
this.
sorry. Bye.
Hey, comments or questions on the motion as presented by Steve and seconded by Anne Marie? Phrased differently, is there anybody who thinks that it's not reasonable to have cost sharing and would?
I think the vote will deal with that. So if this gets voted down, then we have to have a different concept presented.
We're just trying to sort of streamline the process a bit, Steve. I think you're going to get a lot of support for that idea. Okay, hearing no further comment, any comment by members of the public? Hearing none, Maria, will you please call the roll?
Deborah Dees, Anne-Marie Dulege,
Yes.
Steve Julesgaard. Steve?
Oh, sorry. Yes. Am I on mute?
No, not anymore. Thank you. Shlomo Melmed,
Yes.
Jonathan Thomas.
Yes.
The motion carries.
Okay. Thank you. And Jen, excellent presentation. Thank you for all your hard work on this, as well as everybody else who's working to make the Alpha Clinics program such the great success that it is. So thank you.
Chairman Thomas, may I ask one parting question for the board?
Certainly.
Along with this motion, is the budget as Jennifer Lewis presented it, would we present the same budget but with a cost sharing provision that would double the amount that could be expended within the Alpha Clinics? Is that, just want to make sure that we're clear on that.
So as I understand it, Steve's motion was to take the numbers as Jen presented them with the budget presented and require that the institutions cover half that. Is that correct, Steve?
Yes, whatever funds that they request, that request has to include that they'll provide half of, or they'll provide funding equal to the amount that they're going to request. So,
but the award max, as Jen had presented, are you proposing that we cut that in half, or are you proposing that that'll stay as long as they could have a justifiable budget that's twice that and matching it 50-50?
well, so the question is would they use that to bootstrap new activities in? Because I don't think we want to do that, is what I heard. I think that's for another day.
So it'd be half the budget, essentially.
Yes, that's sort of the gist of it all. Yes, I agree.
Thank you.
Okay, that concludes the action items here. We're down to public comment on anything that anybody wants to discuss. Do we have any such public comment? Hearing none, that then concludes the meeting today. The votes taken today will be taken to the May 17th board meeting for full board consideration. And with that, thank you everybody for your time, and we will see you in a couple